Perfect. Okay, recording.
Thank you. All right, so we get started. What time is it?
Yeah.
Everybody for coming tonight and participating and being a part of this with us this evening. I really just wanted to kind of start off with talking about how obviously this year going into everything with COVID, it's completely unprecedented. We all have been a part of this with many challenges, and it's been a year of learning a lot. And I've been really grateful to have Elliot and Dr. Elliot and Lisa and Dr. Lisa Rothstein on this journey with us, going through this. I could not imagine doing this. Even when we started in the summer, Dina and I consulted with many, many schools, with many other health professionals. And as everything just progressed into the school year, realizing how many questions we get, how many things come up constantly, which I'm sure many of you are aware of at this point. There's a lot of gray areas. There's a lot of areas that we have to just make decisions, ultimately constantly coming back to what is our goal. Keeping the kids safe, keeping the family safe, and keeping our staff safe is really paramount here. And we could not have been able to make all these decisions without their help and their support. And I'm really grateful to both of you guys, especially. Been many nights on phone calls, many meetings, many text messages, and no decision has been taken lightly. Everything is with a lot of research. And then everybody goes back to research and consult with other people. We come back together. So just again, really grateful. And I just wanted to open up. I know Elliot, you're going to kind of speak a little bit about what you do, and Lisa and all that, introduce you guys a little bit more. Everybody knows you as family here, part of our school. So I just really wanted to start and set that tone that this is, we wouldn't be able to be who we are as keeping our school so safe and it's not just luck, the way that we have been able to not have a spread through our school. And it's really a testament to everybody being diligent and being safe and making wise decisions and coming together as a school family. So thank you. I'll let you go ahead.
So hi everybody. I'm Elliot. I don't know if I've met every single one of you, but I have Yaya, who's in the Kita Gimel Dalet class, in the 9-1 class, and I have Benji, who's in the Kita Aleph Bet 9-1 class. I've been at IJP for a couple of years. We love IJP and we love the community. So whoever I haven't met, nice to meet you. And I'm sorry to be meeting you under these circumstances, but all working together, I think, will even make us a stronger community. So just quick, my background, Lisa, if you want, you can introduce yourself quickly, and then I can go to a quick PowerPoint. But I work at Grady in the ER there, and I'm an emergency medicine doctor with Emory. I've been with Emory for a couple of years. I teach at the medical school. I'm an assistant professor there. And I do a lot of different stuff within Atlanta in the community and stuff like that, as far as first responder and event medicine and stuff like that around Atlanta. But that's kind of my background. Lisa?
Hi, I'm Lisa Haddad Rothstein. I am sort of the Robin to Elliot's Batman on this committee. I am an OBGYN in training. I've been at Emory and Grady for 11 years, and I just recently left there, and I'm still working as an adjunct associate professor, and I am also working as the medical director at Population Council. I've done a lot of work on reproductive infectious diseases, so not really COVID in terms of my background, but do have a master's in public health, and yeah, that's me. Nice to see you guys. My daughter Noah is in the Kita Aleph Bet 1-3, and I've had 2 boys go through IJP, so they're both graduated out, but have been in the IJP community for quite a bit.
All right. Well, I made a boring PowerPoint to start off with, just to kind of go over a few things. And think we'll open up to Q&A afterwards. If you guys have questions throughout like the PowerPoint and throughout the talk, if you guys just want to put them in the chat box, and then I can start at the end by going through those. And then if there's like other lingering questions or anything like that, you can kind of chime in afterwards and we can go from there. Can you let me share my screen, Dina? So whoever's the host has to let me share my screen. Or you can make me a host also, if you can do that. I can share my screen also. Cool, perfect. I think this is it. Let's see, you guys see my screen? Everyone see my PowerPoint? We're good to go?
Yes, it looks great.
Awesome, cool. All right, so just again, like I said, I'm Elliot, that's Lisa, and this is our first COVID town hall. So hope you guys enjoy. If you guys like it, we are happy to come back and do it again. I'm sure when the vaccines start rolling out widespread, we'll have a need at that point in time. So basically, we're gonna go through the numbers right now in USA, Georgia, and Fulton County. We're going to go over the CDC exposure recommendations, and then the CDC came out with these alternative guidelines about a month or two ago, so we'll quickly kind of go through those. We will talk about the IJP guidelines and the protocols we currently have in place, talking about our community, the children, families, and teachers, and then kind of, as Lisa touched on, kind of what other preschools are doing and kind of our interactions and our relationship with them. And then some Q&A. So basically just at the beginning, I think Ellie touched on this before, but you know, this is pretty dynamic. Obviously in March of last year is completely different than, you know, how much information we know right now. And I think kind of the system we have in place works pretty well right now. A problem or an exposure or something arises, you know, they bring it to Ellie, we kind of all discuss together. It's a big collaborative effort. You know, I go and speak to other physicians, infectious disease doctors, people at, you know, at Grady. I speak to other physicians who actually are on the medical boards at other local schools in the area, and we kind of come back and all talk and make a decision together. So, you know, I think the system in place is really, really good so far. But again, I'm always open to suggestions. And, you know, again, this is all about transparency and working together to create a safe environment for everyone's kids and everyone's families. So I think at the end of the day, we can figure out how to work together. So again, Q&A, if you guys have questions, you guys can put them in the chat, and then I'll go through the chat when we get to that part. And then again, if there's lingering questions, we can go through them. So these are the numbers in the USA. I highlighted February 17th, which was yesterday, and 70,000 cases yesterday. If you kind of look over on the map, we're probably where we were in the beginning of November. But, you know, as you notice, we still haven't hit our trough yet. Cases are gone down 43%, which is amazing. Deaths in the United States have gone down, not as much as cases, but still pretty significantly. So, you know, it's all really, really good news. I don't want to get too excited too quickly, but it's good stuff. Unfortunately, Georgia's got a little bit of a different case. If you look at the graph, we're kind of maybe where we are in earlier December, but pretty similarly. But the big difference is the deaths in Georgia haven't dropped as much. So, you know, in the United States, they dropped 34%, and we're kind of around the 43% case drop that the United States has. But our death rate in Georgia hasn't really changed significantly. Which is, you know, everything is still going in the right direction, but it's just, it's a reflection of the disease takes a couple of weeks to go through your system, and people are still lingering out in the hospitals, and the actual disease that people are getting locally are pretty debilitating. I look at Fulton County, so I just wanted to bring out one of the local kind of large counties in the area. They looked at the graph. If you want to look at the top, the purple is extremely high risk of getting COVID, and the red is very high. And so we're kind of in the very high area right now. There's 258 new cases in Fulton County yesterday. Interesting on the bottom of the slide, the death rate is still climbing, like I highlighted before, but it's, the numbers are going down, but the death rate's going up actually over the last couple months, which is just a little concerning still. And it's a reason just for me not to really be willing to let my guard down yet. And then if you look at the test positivity, it's kind of interesting also. 8% of the people who are tested are positive with COVID. And so if you look at the graph, that's kind of how we were maybe in kind of late November as well. But the numbers have decreased over the past few weeks, but I mean, it's I don't think we're out of the woods yet. And this is just kind of a representation. It's all kind of similar. Cases are going down, but deaths really aren't right now. So what does this all mean? So there's been, again, a decrease in at the national and local level. At our peak, we were seeing around nationally 250,000 cases of COVID a day. Now we're at 55,000 new cases of COVID a day, which is still crazy. It's going down every day, but it's still a very, very concerning number. Like I touched on before, deaths haven't decreased as much. We're still seeing nationally around 2,000 to 3,000 deaths a day. And January was actually our deadliest month of the pandemic, with over 100,000 people who lost their lives due to this illness. Currently, the hospitals and ICUs are full, especially in Georgia. I can speak on the Emory front, but Grady specifically, I mean, it is very, very, very full. We have no ICU beds. Those patients are in the emergency department for 24 to 48 hours before they get a bed. Normal beds for patients are still not available as much, and even patients who have COVID, sometimes they're placed in the hallway with a mask because there are not enough room for these patients. And the waiting room has a high amount of COVID patients as well, and there's really no way to fully separate them from the other patients. And so it's a big mess. And although the numbers are going down, the hospitals really aren't seeing it yet because sometimes the length of stay is a couple weeks to a couple months with this illness. Again, like I said, trends are encouraging, but we're not out of the woods yet. So now I'm going to go over the CDC recommendations. And so the CDC recommends, basically they say the local public health authorities can determine and establish their own quarantine options. But really, I mean, the CDC recommends a quarantine day period of 14 days after you have an exposure. So that they define that as a close contact. What is a close contact? It's a very, very ambiguous kind of gray area that they wrote maybe, 15 lines about it on the CDC website, which I'll read to you quickly. Someone who's within 6 feet of an infected person for a cumulative total of 15 minutes or more over a 24-hour period, starting from 2 days before illness onset, or for asymptomatic patients 2 days prior to test specimen collection, until the time the patient is isolated. So what does it mean, 24-hour time period? So if you can add the exposures together, so 3 5-minute exposures for a total of 15 minutes, and the data is limited, making it very, very difficult to precisely define a close contact. So basically, it goes on and on about how you have to consider the factors to consider would be proximity to the person, the duration of exposure, whether the infected individual had symptoms or not, whether they were sneezing and generating respiratory aerosols, whether the person who is with them knows how to wear a mask properly. Was the mask over your nose for a second, not covering your nose for a second when you're with them or not? Was your mask on your chin? Did you take it down for a second? So the CDC doesn't really have a great kind of recommendation as to exactly what a close contact is. And that's what I'll go into in a few minutes, is kind of why we do a lot of this on a case-by-case basis, because the quarantine time is not always the question, but the actual exposure sometimes is the question that I'm seeing from families, parents, and teachers alike. I'm going to go over quickly the alternative guidelines, which the CDC published maybe a month or two ago. And the intention of the publication was mostly for people who work and had to quarantine for 14 days after a positive test and were losing money because they're unable to go to their job every single day. And they weren't, getting in trouble at work because they had a doctor's note. But if they, weren't working their shift, they weren't going to be able to get paid. So the CDC, long, hard thought and talked about it. And after, 8 months of the pandemic, 9 months of the pandemic, they made these alternative guidelines initially with the working people in mind. I don't think it was initially meant for children whatsoever. But CDC recommends a quarantine period of 14 days. But based on local circumstances and resources, the following options to shorten a quarantine period are acceptable alternatives. So general quarantine after an exposure can end after day 10 without testing if you never had any symptoms. And that's not like you have to have like no sore throat, no runny nose, not a mild cough, nothing. No asymptomatic means like 0 symptoms. Those people who went back instead of waiting the whole 14 days, they found that there was a 1 to 10% chance of post-quarantine transmission. So there's still a chance if you go back for those 4 days that you can still transmit COVID. Again, if they were talking about your kids and say your son had an exposure and you want him to go back 4 days earlier, he still has a 10% chance of still having COVID, giving it to his classmates and the teacher. And again, if the teacher gets it, the class is closed, or if somebody else in the class gets it, obviously. When diagnostic testing resources are sufficient and available, then you can end your quarantine on day 7 if a diagnostic specimen tests negative and you have no symptoms during the daily monitoring. So again, if tests are available and on day 7 you were exposed and your test is negative, they say at the bottom there's a 5 to 12% chance here of a post-quarantine transmission risk as well. And so again, I think these guidelines, again, were initially made for people who are in the workforce who wanted to get back to work earlier and were losing money, obviously. And so the CDC producing these guidelines will let their employees allow them to come back to work earlier, hopefully in certain situations, so they won't miss out on money. But again, going back early is not without risks. Normally, after your 14-day quarantine period, there's a 1 to 2% chance of being able to transmit COVID. I think it's closer to 1%. But again, now there's anywhere from 1 to 10 or 5 to 12% people who adopt these alternative guidelines. And local schools in the area have not adopted these guidelines as of this point in time. So IJP, I'm going to touch upon what we do quickly. And I just want to kind of reiterate that protection of our community, which means the children like our kids, but also ourselves, like our friends, our kids' friends, their parents, their grandparents, our teachers as well, because they're on the front lines. They're the people who we send our kids to so we can go to work and have our life and make our money to support our family. They're the ones there who are doing childcare for us every single day. And I think they're just as important as our children with that respect. So we follow the CDC guidelines at a minimum. And that kind of goes back to the close contact, because again, what's the definition of a close contact? The CDC is a little bit ambiguous and vague. So we do it on a case-by-case basis. Obviously, if it fits into one of the obvious CDC categories as an exposure, then it's an exposure, but certain things that are maybe near misses or maybe possible exposures, we might sometimes be a little bit more strict than the CDC is, or not more strict, but since it's not specifically outlined by the CDC, we would do something that the CDC necessarily doesn't state in their protocol because there isn't one for them. And like I said before, and as Ali mentioned previously, there's a lot of gray area here. And there's a lot of ambiguity here. And so I think at the end of the day, when we all get together and we talk, and when I talk to other schools, I think kind of the most important thing is what I say at the top is the safety of our children, families, and teachers. And when you keep that in mind, I think at the end of the day, then, safety, I think, is the most important thing in preventing transmission of this, deadly virus and getting our families and teachers sick. So other preschools, so I'm in close touch with the medical director at Atlanta Jewish Academy. and I speak to him on a very, very regular basis, probably twice a week. And we go over what they're doing and what we're doing here. And pretty much we align exactly with what they're doing as far as protocols for their first grade and below. And for kindergarten and below, sorry. For first grade and above, we are actually having the same protocols as them, but as the prevalence of the disease is decreasing, for kids who can wear masks and whose teachers at the front of the classroom, they're considering possibly changing the guidelines to the alternative guidelines, but they're not sure yet, and they're probably going to wait another month at least before they're going to do it, because we want to make sure that the trend is going down. And again, this is for first grade and above. For kindergartens and below, they recognize that mask wearing is, as good as you can be, and sometimes it gets taken off, and sometimes things happen. And, again, the teacher's not at the front of the classroom; they're more interactive with the kids, and they just didn't feel that it was appropriate for kids that were younger. I actually toured Epstein today for school for Yaya, just as a tour for school, and went over their policies with them as well, interestingly enough, because she had an interview for an hour and a half time, and their policies are very similar to ours as well. In a couple areas, they're a little bit stricter than us, actually. But other than that, no one's more lenient than us whatsoever. And so again, we consult with these groups and these schools on a regular basis. I also have a friend who works at the Atlanta Public Schools, that they weren't in person for a long time, so it wasn't a really big deal. But we really think it's important. I mean, safety of our kids is important. If somebody else is doing something that we're not doing because they think it's safer, then we'd like to know about it and at least put it into the mix of discussion. So again, lecture's coming to an end. So hopefully you put some questions in the question box, and if not, we can just ask you. But more to come. I know Ellie has made an exposure checklist, like if you've had an exposure, kind of what to fill out, what to know. We're gonna kind of make sure that it's mainstream, but I think it's already mainstream right now. And again, it just kind of goes over what exactly happened. Where were you? Were you indoors? Were you outdoors? Were you masked? Were you unmasked? How long were you there with them? Was the person symptomatic? When did they find out that they were positive? Kind of all those questions that, instead of having to go back and forth 100 times, so you have everything at first, and kind of, also know how much of a risk you're at. Because again, we're letting you know how much of a risk you are for a classroom as well. But, at the same time, we're letting you know, how much of a risk it was in general. We're also going to be making a formal travel guidelines, and we're going to make a pre-travel worksheet. Ideally before you travel, we'd like you to let us know a week before and kind of give us information about travel, so we can make a decision together and make sure that it's safe, and decide on if you're going to have to quarantine before you travel or not. If you want to submit the travel plan much more in advance, obviously if you're flying somewhere or something like that, you need to book tickets, then, we welcome those pre-travel worksheets earlier. And once we have them in mainstream, mainline, we will get it out to everybody. But I think in the meantime, if you plan to travel, please let us know, the earlier the better, so we can kind of talk to you whether you're going by plane or by car. And if you're going to an area that's has a higher rate of COVID than Atlanta, and kind of what you're doing when you're going there. And I know it's a little bit intrusive, and I'm not super interested in what you're doing on vacation, but it's just kind of just to be transparent for everyone's safety. And I really appreciate. I want to take a second, because everyone's been really transparent, because we've done such a really good job so far. Like, not me and the medical team, but all of us as a community have done such a good job right now, because we've had 0% transmission rate in our school. I mean, we have not had one case of in-school transmission. So, it's a testament to everybody. More town halls. If this was beneficial and you guys like this, we'll do more. I think when the vaccines are available to the general public, I think you guys might want to do another one. If you guys think this sucked, then we don't have to ever do it again. So again, like I was saying, so vaccines in decreased numbers and our trends going down may equal dynamic changes in the policies and protocols. So as you guys have been so flexible and patient in the meantime, we appreciate it. And, there's going to be a lot of changes in the near future, especially with this vaccine. The CDC, one cool thing is that the CDC has now said for people who are vaccinated within the last 3 months, if you do have an exposure, they do not recommend a quarantine period. So for our teachers, that would be interesting to know. And again, we'll have that discussion once our teachers are able to get vaccinated. But teachers now who have exposures have to be out and the class has to shut down. When that might not necessarily need to be the case in the future. But again, more to come in the future. Some food for thought. So again, I've been stressing this a lot, but please remember how special this community is and how lucky we are to be a part of IJP. Remember why we all came to this institution in the beginning. Remember the family vibe of how we all feel like we can lean on each other and how we all are here all for each other. I didn't want this job. This was not something that I wanted to do, to tell everyone, what to do and what they can, what they can't do. But, there was a need for it. And this is a really, really big deal, pandemic that's killed, tons and tons and tons of people. I thought it was important, and the IJP thought it was important to have a medical team to ensure kind of the safety of our kids and our families. And so I just want everyone to remember, that at the end of the day, it's all about being safe and making sure that we create the best environment for our families and for our teachers as well. And when I get frustrated that Benji's home for 2 weeks and, it was my decision, I think back to why, we all are here. And it's the sense of community that we get from being part of IJP. And again, our 0% in-school transmission rate at IJP, I'd like to highlight because, again, not to pat ourselves on the back a million times, but we haven't had one. We've had multiple cases of teachers, of people, with COVID, but no one transmitted it in school. So, I think that is a testament to how well we're doing as a community at being transparent, honest, and being forthcoming when you have an exposure. So time for question and answers. I'm gonna go back to stop sharing my screen.
Thank you, Elliot. That was amazing.
Elliot, I want to add a couple things, just to highlight a couple of things that I think you touched upon, but maybe to reemphasize. So when Elliot showed the alternative guidelines, he expressed the rates of 1 to 10% or whatever the risks were with different algorithms for how that potential for transmission may take effect. And we've looked at that really carefully and thinking about what the alternative is, and also the nature of IJP and the close connections the kids have with each other, putting that risk, even though it's a huge burden for the individual who is on quarantine and can't rejoin the class, the thought was that maintaining the opportunity for the community to be safe was the priority. And it's really frustrating to be that family that has the kid at home. We've all been there, and unfortunately, it's challenging. But on the flip side, maintaining the opportunity to keep the community safe was the ultimate goal. And part of the reason for having this town hall in the first place was, as a community, we all need to be on board and we all need to agree that this is the objective. And the thought was, well, maybe we need to put out all the information out there. There's a lot of smart individuals who are part of this community. And if everybody strongly disagrees with that approach, then we need to revisit that approach. But even in discussions with individuals, if there's even one individual that feels that we need to be on the conservative side and really try to maintain that 14-day quarantine period in order to maintain the higher degree of safety, that's going to be the objective that we're going to take in order to really have a community that's inclusive and really attending to the concerns of every individual within the community. And so that was some of the motivation for having this discussion in the first place, is so that everybody understands what information we're working from and are not thinking that these are just random decisions that are being made without attention to balancing the individual's concerns with the community's concerns. And so hopefully Elliot can answer specific questions, or I can, but just to know that, and also know that Ellie is always like, well, what do you, very much bringing up questions, trying to advocate for every individual in every situation, and then trying to find a balance where we're really trying to be, again, create the safest environment, but also reduce the amount of time that anybody has to be at home. So that's, hopefully everybody's happy with that.
All right, so if anybody has questions, I didn't see, I don't think I saw anything in the chat box. You can always feel free to email me if you have questions about like just anything that's going on, or if you want to chime in and have some questions right now, I'd love to take some questions. But again, as Lisa said, again, you know, it's all about transparency and it's all about the safety for everybody. And, you know, with the alternative guidelines, keeping your kid home for 4 more days to, you know, prevent possible 10% chance of the teacher getting sick or another student getting sick for our community, I think is kind of pretty important. And so we need to protect everyone and be thinking about everybody here. And I also wanted to say just again how much I appreciate everyone being so upfront and honest and easygoing. This is not kind of an easy job for me, and like I said, this is not something that I want to do. It's, you know, you're not. It doesn't work without everyone doing their part, and so I appreciate that. And if you guys have questions, please chime in.
Thank you, Elliot. Thank you. And Lisa and Ellie, you guys are just real champs and keeping us all safe and healthy. And, you know, this is like the volunteer job of the year. Not, you know, it just really, this is all volunteer and it's hours and hours. So we're really, really, really grateful for your expertise and your care. Questions, anyone who has questions, just unmute yourself or put it in the chat.
Oh. Hey, Elliot. You know, being in the medical field, is there a timeline when the vaccine is going to be released just to the general public, or at least in the state of Georgia?
I wish I knew. I do not know right now. My thoughts and what I'm hearing down the pipeline is it's going to be hopefully by March, but early March. But I'm not. It could be late March. I think sometime in March we can be hopeful for. But what I've been hearing is it might not be until late March.
So question, if you know how they're doing the different tiers of who gets vaccinated. So let's say like Eric gets it because he's like terribly asthmatic. Do our kids get to stay at school all the time?
I don't know. I think adults are going to get it before kids. I think kids are going to be maybe at least 6 months before the kids can get it. But maybe, I don't know, we're going to have to revisit it at that point in time. But it definitely could be a possibility. When you're vaccinated, again, if you have an exposure currently with the CDC guidelines, you don't have to quarantine.
Okay.
I have a question. Well,
Sure.
do you think there'll ever be a COVID squirt like there is for the flu shot?
You mean like a nasal vaccine?
Yeah. Do you think they'll ever do that for the COVID?
Yes.
Right. Just some of us have guys who are hard to take shots.
Yeah, so I think it goes for a couple reasons, because also nasal vaccines, one of the reasons, so with the COVID vaccine, as you guys all know, there's still maybe a 4% chance that you can still possibly get COVID and transmit it. Some people cite it a little bit lower, but it's around that, or at least that you can be able to harbor it and transmit it. And so that's because it's a muscular vaccine, and muscular vaccines go in your muscle and they replicate in your muscles and go throughout your body through your bloodstream. Nasal vaccines work a little bit differently. When you get a vaccine in your nose, it starts to replicate in your nose first and then your bloodstream, and you can get bacteria that just grow in your nose, and it doesn't mean you're infected with it, it just grows there. And so part of the advantage of having a vaccine that goes in your nose is it also prevents it from growing in there. And so nasal COVID vaccine actually would almost reduce your risk of getting COVID by 99 to 100%.
Well, thank you, Dr.
Very high.
Rom. That's great. All right.
And just to emphasize what Elliot was saying, our hope is that the community rates will go down so much that hopefully we can go back to this semblance of normality. You know, our children are probably not going to be vaccinated for a very long time. And so whether the parents are in that environment, that we're safe. And we know that severe illness in children is very, very rare, but it's not zero. And I think as parents, we're always concerned about, well, hopefully our child will not be that one child that gets severely ill, but hopefully the rates will be down substantially in such a way that there's herd immunity and we don't have to be anxious about it all the time. So.
Any other questions?
I was just going to add, can you mention about the secondary exposure? I think that might be helpful.
What specific question?
Like what is a secondary exposure and how we make a decision about siblings?
So a secondary exposure is if your sibling or if you as a parent who is exposed and then you have your kid there who's secondarily exposed to you. And so we try to look at it on a case-by-case basis, but generally secondary exposures have such a low risk of being able to transmit COVID because, I mean, it depends on the nature of the primary exposure, and that's why we look at it on a case-by-case basis. But if it's a mild or lower kind of risk exposure, the chances of getting COVID in the first place from that set exposure, especially, is fairly low. And kids have a pretty low transmission rate as well. And so if you're going to have a secondary exposure, that possibility is so low that it's pretty much negligible. And we, after a long discussion, we thought that these secondary exposures, if your dad was exposed to COVID and you live with your dad, but it was a mild exposure, we decided that you're still able to go to school at that point in time. And unless it was a very high risk exposure initially, and we think that you could have probably gotten COVID or likely gotten COVID, then, those cases, those secondary exposures are very high risk.
Low risk.
And just to emphasize that Elliot's point there is that that's why siblings are not necessarily having to quarantine when another class quarantines. So that the thought that the likelihood that even if your class is quarantining, that the child itself, that child actually has COVID because they had the exposure and that child transmits it to another child in the class to bring it to the school is quite low. And so therefore we feel that that individual can go to class.
And also, if you had initial exposure, and again, like we said, it was low risk, and you're if your sibling or something like that, if you initially were the one who was exposed, like say your brother was exposed, the person who was exposed needs to quarantine. Again, it's hard to quarantine a 2-year-old kid or a 3-year-old kid, but again, the idea is if you're exposed, you need to quarantine. So, again, you got to try to keep your siblings apart because one of your kids had an exposure, and you personally, as a parent, doesn't want your other kids to get COVID. And even if it's low risk, you got to try your best. Nothing's perfect, but you got to try to, and that was another reason why we thought, again, secondary exposures were less risky as well, because if you were exposed to COVID, you should try to quarantine. And so that's the idea.
I think it's hard to understand sometimes that as a parent, because it seems so silly to me that I could even keep my 2- and 4-year-old away from each other, or that they're not both exposing me to whatever they have and that I'm not hugging both of them. So it seems like kind of like honky, and then you get, or wonky, sorry, not honky. So then you get a teacher in another class who's sisters with another teacher, and then it's like by the time it gets to my kid, I feel like it's 4th degrees already, and then but I'm still sending my 5th degree, which is my other kid, to school. So I know you guys are trying your best. Sometimes it's just really hard, like logically, for me to think, like, I don't understand why I have her home for 2 weeks, but my other kid's okay to go.
Yeah. It's definitely hard on those issues. Like if you have questions and can't get around it, always feel free to email me, reach out to me, and call me. Because again, none of this is like simple, and none of this, there's no right answer, right? So, again, the CDC is vague about this, and it's ambiguous. And so, like you said, we do the best with what information we have. And some of the stuff, again, like there's no right answer. So we try to err on the side of caution and be as safe as possible to protect the kids in the community, and kind of look at it on a case-by-case basis. If it was a really risky exposure, then those secondary exposures are more risky. And then furthermore, it's really, really hard to keep your kids apart if they had an exposure, but you try your best. Benji had an exposure at school with a teacher, and we didn't stay away from him, but I tried to keep Yaya and Benji apart as much as I could. And again, you can't, because they're going to be kissing on top of each other and stuff like that, but you try your best, and that's all we can ask of anybody. And that's kind of all what we're doing here is the medical team. We're kind of trying our best, and we want to try to limit the possibility of exposure, but there's no right answer to any of this. And anybody who thinks that they know what they're talking about fully and has all the right answers is completely incorrect. And I don't have all the right answers. And that's why we reach to all these other sources and collaborate and try to all kind of work together to try to provide the best possible answer at the time.
Yeah. I was just going to also add, maybe just to bring up, because there might be some thoughts around this. Just, can you clarify, I guess, the protocol for if a parent does get COVID, notifies us that they tested positive, and how we go about that, and recommendations for trying to quarantine and all of that, and what the thought process is a little bit with that?
Sure. So if you're a parent who tests positive for COVID, you need to quarantine from your kids as best as possible. Again, some people don't have the ability to be able to do that, and you don't have that opportunity. Most people actually don't have that luxury, but some people do. If you have family, if you have other sources of childcare, or other means of being able to do that, try to quarantine as much as possible from your kid. It's really, really not easy at all, and in most cases you can't. And so in those cases where you can't, we're generally waiting until you're 10 days after you're tested symptom free, and 2 weeks from that point in time. So your kid's last possible day of being exposed to the virus, and then 2 weeks from that. So if you're asymptomatic and you have an exposure, we wait until you're out of the exposure time period, and then we wait 2 weeks from there. If you have symptoms, we wait 48 hours until you have no symptoms, and then 2 weeks from that. And that's in conjunction, again, with what AJA and what Epstein is doing as well. And I don't like that rule at all. Trust me, I really don't like that rule. I wish we didn't have to do it. But again, looking at what other schools are doing in the area, it seems to be the safest option for our kids. And a lot of this sucks, it's not fun stuff. It really, really sucks. And there's a lot of gray areas, and I don't think anybody's happy with it. And it's just all about trying to roll with the punches. And again, if you ever have any more questions, Julie, you can always reach out to me, email me, call me. I'm here to talk about it.
Thank you. Yeah, I think we're all just really grateful that we can come to school, and that we have our teachers showing up every day, coming to school and really put themselves out there. I want to really just spotlight them for a second, because they did not go into this profession. Not that it's easier for you two, knowing that you went into the medical field and sometimes you're putting your life on the line. Our teachers did not go into this thinking that this is how they show up to work with their life, at risk every day, and they still do it, and they show up with smiles and lots of love and dedication and grace, and I'm just really grateful for them and for all of you guys. And thank you, everybody, for coming tonight. And we'll send out a survey after this just to kind of follow up. If there's anything else, if anybody else has any other questions that they think of later on, always, you can direct them to me, direct them directly to Lisa or Elliot, whatever you're comfortable with. And thank you.
If there is going to be a sub in the classroom, is it okay if the administration emails the parents? I feel like it's a lot for the teacher to have to try to do that after. Do you know what I mean?